Hell of a thing. United Health paid nursing homes to reduce hospital transfers. I'm going to explain what that may mean, all right? Put up the picture full mask here. Massive investigation by The Guardian revealed that UnitedHealth Group secretly paid nursing homes to reduce hospital transfers. The insurer quietly paid facilities that helped it gain Medicare enrollees and reduce hospitalizations. The whistleblower alleged it harmed residents. UnitedHealth Group, the nation's largest healthcare conglomerate, has secretly paid nursing homes thousands in bonuses to help slash hospital transfers for ailing residents, part of a series of cost-cutting tactics that has saved the company millions, but at times absolutely put the residents' health at risk. Those secret bonuses have been paid out as part of a UnitedHealth program that stations the company's own medical teams in nursing homes and pushes them to cut care expenses for residents covered by the insurance giant. In multiple cases, nursing home residents who needed immediate hospital care under the program failed to receive said care after interventions from UnitedHealth staffers. At least one lived with permanent brain damage following his delayed transfer, according to a confidential nursing home incident log, recordings, and photo evidence. One current UnitedHealth nurse practitioner who recently filed a congressional complaint about the nursing home program stated, "No one is truly investigating when a patient suffers harm. Absolutely no one. These incidents are hidden, downplayed, and minimized. The sense is, well, they're medically frail and no one lives forever." The investigation is based on thousands of confidential corporate and patient records obtained through sources, public records requests, and court files. Interviews with more than 20 current and former UnitedHealth and nursing home employees, and 2 whistleblower declarations submitted to Congress this month through the nonprofit legal group Whistleblower Aid. To reduce residents' hospital visits, UnitedHealth has offered nursing homes an array of financial sweeteners that sounded more like they came from stockbrokers and medical professionals. Over the past 7 years, the company has shelled out premium dividend and, quote, shared savings payments that boosted nursing homes' bottom lines. Through its, quote, quality and share risk program, UnitedHealth offered an even bigger cut to nursing homes that drove down medical spending but threatened to claw back money from those that did not. So in plain language, you have a big company, as a matter of fact, the biggest. They have created an internal program to incentivize nursing homes to cut down on insurance claims by cutting down on the number of hospitalization transfers from the nursing facility to a hospital. And why is that? Because the hospital charges more, meaning the insurance company has to pay a higher bill. But if you keep that person, that patient who has coverage inside of the nursing facility and you do not transfer them to the hospital, well, you get a bonus. Yeah, you get a savings bonus. When people suffer because of this scheme, when people die because of it, it should be what it is. They should be charged. If somebody dies, that's murder. If somebody is severely injured, well, that's criminal negligence. It can be assault, medical negligence. Why is this not being talked about? Well, according to the nurse practitioner because it's not thoroughly investigated, which is intentional. There's more. But the secret bonuses were just one of the many maneuvers UnitedHealth decided to use. Internal emails show, for example, the UnitedHealth supervisors gave their teams, quote, budgets, showing how many hospital admissions they had, quote, left to use up on nursing home patients. What kind of foolishness are we talking about? So if somebody has a medical emergency, you have families that have entrusted you with their loved one. They have a medical emergency, but you are out of budget. I'm sure you don't share that with the individuals who check their family members into the facility. You're out of budget. So what do you do? What call do you make? We would like to save the life of Mr. or Mrs. So-and-so, but we can't because a damn corporation told you don't have money to do it. The company also monitored nursing homes that had smaller numbers of patients with, quote, do not resuscitate or DNR and do not intubate orders on their files. Without such orders, patients are in line for certain life-saving treatments that may lead to costly hospital stays. Do you hear that? The company denied that it prevented hospital transfers or inappropriately pushed patients to change their code of status to DNR. So here's what I'm going to do. This story is one of those that we should have more information than we do. I believe mainstream media should have more reports on it than it does. And unfortunately, because of the chaos of Congress and the ridiculousness of this current president, the focus isn't going to be where it should be. This is something that bypasses all partisan background and politics, because when you put your loved one in a facility like this, you give a damn about their care. You give a damn about their health. You don't care about the politics of it all. So when we finish this show, this clip is going directly to United States Senator John Ossoff. And we are going to directly ask John Ossoff to get involved and to advocate for the individuals who are speaking up, and to the nurses, to the practitioners, and to the administrative staff who have gone on record. I want to say thank you, because without you, we would not have known this was going on. Sharon, thoughts here?
Thank goodness you mentioned the good senator from Georgia, John Ossoff. Your story is my story, Doc, and I'm sure you understand what I've been through, because you got many a frantic call from me, some in the middle of the night, where I begged you to use your relationships and leverage to get my mother the help she needed.
Yeah.
Senator Ossoff might be interested in a recording I have on the night my mother fell out of bed trying to go to the bathroom and nobody came to help her. And she happened to call her daughter. And I just, being the reporter I am, recorded it because I was tired of these people. And when they realized I was on the line, they muted the call for several moments before getting back on the line. My mother broke her hip and was in severe pain, and they did not want to take her to the hospital. And I let them know they had not even seconds to get an ambulance there. This is routine. UnitedHealth is disgusting. And you see why so many people are upset.
Yes.
So please, let the senator have my number too, Doc, because I'd be happy to testify.
Yeah, we're going to definitely do that today. I will keep you updated on it. I'll bring the updates to the audience as they develop. All right. Sorry that happened.